Learning how to activate and engage your TVA muscles for diastasis recti will make all the difference in the world to your diastasis recti exercises and your healing journey. You know you need to do specific core exercises, and maybe you even have heard that you've got to do TVA exercises for your diastasis recti, but you're not quite sure how to do it. Are you doing it correctly? And what exercises should you do while engaging your TVAs? Keep watching because that's what we're getting into today. Welcome to the Strong Mom channel. My name is Denise, holistic nutritionist and personal trainer for moms, helping you to get strong from the inside out with a flatter belly after baby. If you are new to the channel, please make sure to join me in the Tummy Fix workshop. This is a workshop that I put on every 6 weeks so I can tell you exactly what you need to do to flatten your stomach after baby and heal diastasis recti. So the TVA muscles. TVA, which is what they used to call it, and now they call it just TA, is transverse abdominis muscle. And this is a big, very large muscle that wraps around our whole abdomen. And some people actually refer to it as the corset muscle. So throughout today's video, I'm gonna be referring to it as TA or TVA. The TA muscle is the deepest core muscle that we have. And as you can see from the picture here, it's deeper and behind the rectus abdominis. As well, it's still behind the internal oblique, and which is probably why it is one of those hardest muscles to actually activate and engage. What the TA muscle does is it draws in and lifts up the lower abdomen. And we want this because so many moms in postpartum have a big problem, a big trouble with the lower abs. Probably about 90% of the comments that I get on my YouTube channel, the moms who are in my group fitness class, as well as the moms who come to me to work with me in personal training, are all complaining about what do I do about the lower belly, the fupa, the mummy tummy, the pouch, the pooch, whatever you want to call it. It is a big problem and a big issue. And it's all located in the lower abdominal region. So why do moms have this problem in the first place? It's because of pregnancy. After pregnancy, we have this lingering laxity or even weakness in that low area. For some moms, it looks like their belly, that area is just sticking out and it has just a lot of laxity to it. There is no strength. It just feels really weak and mushy. So being able to engage this area with TA exercises lets you work this troubled area to reinforce the muscles and the tissues that just need a little bit of extra help. Not only are TA exercises going to help you have good control of your core and flatten it and make it stronger, but because this muscle wraps around the whole abdominal wall, engaging, retraining, and strengthening it is also going to help those moms who have low back pain. Mamas, I want you to type in the comments below and let us know, what are the symptoms of your diastasis recti? What is your belly looking like? Is it looking like you're bloated or pregnant all the time, or you got some doming or coning, or maybe you just have weakness, or maybe your belly feels like mush? Give us those descriptive words. Tell us what it looks like or feels like down below. So obviously this area has tissues and fluid and organs. And so by doing the TA activation, what it's doing is pulling all those organs in, making them more compact, less squishy, and making you feel more supported and less weak. So the TA's job here is repositioning those organs closer in towards our belly and inside our bony landmarks. So think your bony landmarks as your rib cage and your pelvis, right? It's bringing those organs in closer to us as opposed to outside of our skeletal system. So by doing TA contractions, our desired outcome is to pull everything in, making those muscles and tissues stronger, as well as the anatomical repositioning of our abdominal wall, right? We want everything to not be stuck out. We want our belly to be flat and keep everything in where it should be. This stuff is not easy, and it's all about the mind-muscle connection to that lower TA muscle so that we can spend time doing this day after day after day so we can become stronger and reconnect with those muscles again. Because the TA muscle isn't sexy and nobody's talking about, look how ripped my abs are because I'm working my TA muscle, I feel like the TA just doesn't get the love that it needs to, but it is just as an important of a muscle as any other ab muscle. And I'd probably say even more important for us who are in our postpartum journey. And remember, once postpartum, always postpartum, right? Because if you are a mom, you don't care about having ripped, chiseled abs. You just want a flatter tummy, flatter than it currently is. And if you're a mom who's dealing with back pain all the time, you just want to get the back pain gone. And studies show that the TA muscle acts differently than the other ab muscles that you probably think about, right? Your six-pack abs or your obliques. And we need to isolate the TA muscles. So that is what I'm gonna be showing you how to do right now. Okay guys, are you ready? Let's stand up together so I can demonstrate this with you. So what I want you to do, I just rolled my pants down a little bit so you can see, I want you guys to see exactly what's happening here. So I want you to put your fingertips on your bony protrusions here, your hip bones, your ASIS. So just medial to that, about an inch, you'll feel, it's like, you know, you got your bones here and right here. It's a little bit squishy. It's a little bit taut here, but this is where we're gonna be working. So I always call this the seatbelt muscle, right? Because when you're in a car, put your seatbelt on, the lower strap and the lower abdomen comes here. So for that, I'm gonna be calling your TA muscle here the seatbelt muscle. So I'm just kind of like tapping. I wanna say, hey, wake up. I'm gonna be working you. Remember, this is not gonna come automatically. This takes time, right? And I see this with my clients in online personal training, as well as my clients in the Tummy Fix program. So it takes time to connect your mind to the muscle. So don't worry if you don't get it the first time. All right, so what I want you to do here, I've got my seatbelt muscle. I want you to imagine that you are gonna, you got hip A and hip B, and they are attached by a string. I want you to imagine that you are trying to tighten up and bring one hip towards the other. So really trying to like tighten up that string here. Okay, so what I don't wanna see, which is what a lot of people do, is suck their belly button in. I do not want belly button sucking in. We don't want that at all. What we want is a slight draw in of the low belly. I don't want sucking your belly button to spine. I don't want that. We're using our obliques, we're using other muscles. I want to use the TA muscle here. So what you're going to do is just think about drawing those two hip bones closer together. And I just want you to feel it all down here. I don't want you to be feeling and gripping up here in your, upper obliques and your abdominals here. So right here, the best way is to exhale while you're doing it. First, inhale. On the exhale, draw in right here. And again, I like to tactilely tap, tap, tap to kind of just wake things up here. All right, inhale again. And when I inhale, air does fill in my belly. On the exhale, do you see that? Do you see when I inhale, the air fills my belly? On the exhale, it slightly pulls in. So that's exactly what I want you to be practicing with these activation exercises. So we did this right now, standing up, but where I wanna go is the next position, to seated. Okay guys, I want you to grab a chair like I've done. I'm sitting on my chair here, and we want to be sitting on our sits bones. So I just pulled the flesh away from my butt here. And what we want to do, again, here, I always have my fingertips in that area. Inhale first. On the exhale, slightly try to draw those hip bones in towards each other. So do you notice that when I'm doing this, I use my exhalation breath, right? You can feel the flattening of the lower abs as opposed to pushing out. Some people will do this incorrectly and brace and bear down on their pelvic floor instead of draw in. That's not what we're going for here. We want it all to come in nice and tight. In our next position, we're going to come onto the ground in side lying. And I want you to lie down here. You're going to have a nice straight upper body, right? feet are my hips are stacked, my knees are stacked on top of each other. I'm just like really pretty relaxed in this position here. And we're gonna do the same thing. Inhale first. On the exhale, tap, tap, tap. And I always like to say that with TA exercises, less is more. If you are, and you see this, do you see how right, how I tensed up and braced? That's not what we're going for. We're going for really, really slight, gentle drawing in and up. So like I said, this is going to take some time and work in reconnecting our brain with those muscles down there that maybe you've never ever done any kind of TA exercises before, and that is okay. That's why I am here. That's why I'm on YouTube, and that is why I'm training moms and teaching them all the things that I know to get a flatter belly after baby. All right, let's do a couple more positions. Let's lie down on our back. Let's do the same thing here. Inhale first. Exhale. See that drawing in. I even like to hold it and brace while I am still breathing and talking to you, and then I can let go of it. Okay, so I've only been showing you maybe and going through a few breaths with you, but when you are on your own, I want you to try this about 10 breath cycles in each position. See which one is best for you, see which one's easiest for you, and I want you to start with that and then work your way to progressively harder positions. But ladies, just activating and contracting your TA is just one small part of healing your diastasis recti. If you're looking for hand holding, you want my proven blueprint to get you from where you are today to flat belly and feeling strong without back pain, without leakage, then I highly encourage you to complete my questionnaire down below, and let's see if we can work together, if we're a right fit for online personal training. I'll put that down below. Tell me what's going on, and let's set up a time to chat together. And the final position that we're going to come into is all fours. So I want you to come onto all fours and stack your hands directly below your shoulders. And again, same thing. If you find or you see where, maybe your upper abs are gripping or, doing the job instead of the lower TA, that's when you kind of want to, okay, I need to rest, maybe get into a different position. We don't want to be having that upper ab engagement. It's all low TA. So like I said, this stuff is not easy. It takes time, it takes repetition, but I walk all of my clients through this. Whether you have diastasis recti or not, or maybe you've had a C-section, or maybe you just feel weak down there, this is the foundational stuff that I bring all of my clients through. And it takes time. I see many of them work on this for a week, maybe 2 weeks until they get it. So now you know how to activate your TA muscle and make that mind-muscle connection stronger so that you can get a flatter belly after having a baby and heal your diastasis recti. And I've given you a few positions to be practicing this TA contraction in at home. But if you want some more exercises that you can apply this TA contraction breath with, then I encourage you to check out my Diastasis Recti Mummy Tummy playlist. I'm gonna put the link down below where you can take this breathing exercise, this TA contraction, and apply it to any of the workouts in that playlist. If you like this video, please make sure to give it a thumbs up. Make sure to subscribe to my channel and hit the bell so you never miss a Diastasis Recti video. And please let me know in the comments below, where are you struggling, or what are you struggling with the most when it comes to healing your diastasis recti? Let me know in the comments below, and I'll see you next time.